Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Today we will discuss one of the most important topics and the base of clinical pediatric dentistry, which is the difference between primary teeth and permanent teeth. This is very useful during any treatment during mixed dentition period and when there is any abnormalities present. This is also a short note question for both undergrads and PG residents and many MCQs for NEET MDS exam perspective also. So the difference starting with the eruption. The eruption of the primary teeth begins at 6 months and the duration is 6 months to 6 years. The eruption of the permanent teeth begins at 6 years. Primary teeth are smaller and the permanent teeth are larger. Primary teeth are wider mesiodistally in relation to occlusio cervically. They are wider mesiodistally than in relation to the occlusio cervically. In permanent teeth, wider occlusio cervically than the mesiodistally. Shape. Cervical ridges are more pronounced. You can see here there is a more bulk here in the primary teeth and not very prominent in permanent teeth. Narrow occlusal table because of occlusal convergence of buccal and lingual surface of the molar. There is a narrow occlusal table because of the buccal and lingual convergence, and in permanent tooth wider occlusal table. Cervical constriction is prominent and cervical constriction not prominent. Mammillans are absent in primary teeth and mammillans are present in the young permanent teeth. So mammillans are the three rounded protuberance which are present on the cutting edge of an incisor tooth when it erupts through the gum. Canine tends to be more conical in shape and cusp tip is more pointed and sharper in primary teeth. Permanent canines are less conical and their cusp tips are less pointed. Crown of second molar is larger than the first molar. First permanent molar is larger than the second and third molars and size of crown gradually decrease from first to third molars. Deciduous molars are more bulbous with the marked cervical constriction and permanent molars have a less constriction of neck. Supplementary grooves are more in the primary molars. Primary molars are more caries prone due to the easy food lodgement due to the supplementary grooves, and supplementary grooves are less in the permanent molars. Basically, grooves are the linear depression in the crown and supplementary grooves are the small ridges, irregularly placed grooves not at the junction of lobes or the major portion of the teeth. Primary teeth are 20 in number and permanent are 32 in number. Primary teeth are lighter in color, basically known as a milk teeth because of the refractive index of the milk and enamel are the same. Permanent teeth are yellowish white in color. So refractive index is the ratio of the speed of the light in the air or vacuum to that of the particular medium. Refractive index of enamel is around 1.62 and milk is around 1.35 to 36. Both exhibit diffuse light scattering which prevent the clear transparency and resulting in a soft white glow. In contact area, broader contact area located gingivally in primary teeth and contact points are present in the permanent teeth which are located occlusally. So contact area present in the primary tooth and contact point present in the permanent teeth. Coming to the pulp chambers are larger in the primary teeth. Here you can see large pulp chamber and here small pulp chamber. Pulp horns are located at the higher level. Pulp horns are located at the higher level, especially mesial pulp horns in the primary teeth, and pulp horns are relatively away from the outer enamel surface. You can see the difference here and the here. Root canals are narrow and tortuous in primary teeth and wider and do not have extensive branches in the permanent teeth. Floor of the chambers have many accessory canals because of early furcation involvement in the primary molars and not so many accessory canals in the permanent teeth. Pulp is highly vascular and has a high potential of repair in primary teeth, and not highly vascular pulp and potential for defense is less in permanent teeth. Coming to the roots of the primary anterior teeth are narrower mesiodistally. Roots of permanent teeth are wider, measure distally, longer and slender in comparison to the crown size. You can see here compared to the crown, there's a longer roots and shorter in comparison to the size of crown. Furcation of molar roots is placed more cervically, so the root trunk is much smaller, and furcation in permanent molar is placed more apically, so the root trunk is larger. You can see here there is a less gap and there is a more gap. So here the root trunk is smaller and here the root trunk is larger. Flaring of the roots is more, and roots do not flare at the cervical region. The flaring is more because in primary teeth the flaring continues further to the apical third to accommodate the developing tooth jump, and roots do not flare at the cervical region in permanent teeth. Apical portion of the canal is much less constricted than the permanent tooth, and apical foramen is wider in primary tooth. An apical portion of the canal is constricted and apical foramen is narrower in the permanent teeth. Primary teeth undergo physiologic resorption. Permanent teeth do not undergo physiologic resorption. Coming to the histological section, so thickness of the enamel and dentine is less in primary teeth. So the thickness of the enamel and dentine in the primary teeth is less compared to the permanent teeth. Enamel and dentine are less mineralized in primary teeth and more mineralized in permanent teeth. The direction of the enamel rod slopes occlusally in cervical region of the primary teeth, and the direction of the enamel rods slopes gingivally or horizontally in the permanent teeth. So you can see here the direction of the enamel rods oriented occlusally in the primary teeth, and direction of the enamel rods is horizontally either or the apically in the permanent teeth. Dentinal tubules are less regular and dentinal tubules are more regular in permanent teeth. Cementum is thin and made up of only primary cementum in primary teeth, and cementum is thick and both primary and secondary cementum present in the permanent teeth. Anchorage of primary teeth is comparatively less firm and easily resorbed and can be easily extracted. Permanent teeth are firmly anchored in alveolar bone and not easily resorbed. Mineral content both enamel and dentine are less mineralized and less dense in primary teeth, and enamel and dentine are more mineralized in permanent teeth. Neonatal lines are present in all primary teeth both in enamel and dentine, and neonatal lines are seen only in the first molar, and the mineralization begins at the birth. So only in the first molar we can see these are the references. If you want these as a PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll share you the PDF. New videos on Sunday. We also put image based MCQs in pediatric dentistry in our shorts, and we'll put lots of other type of MCQs related to pediatric dentistry. So press the bell icon for every update. Like, share and subscribe. Thank you.